So, what is a scalp biopsy? A scalp biopsy is a medical procedure in which small pieces of scalp tissue, including hair follicles, are removed from the scalp for examination. This is typically performed in order to diagnose various hair loss and even dermatological disorders such as alopecia, scalp infections, or inflammatory scalp conditions. The procedure is usually done under local anesthesia to minimize discomfort. The area of the scalp to be biopsied is first cleaned and numbed with a local anesthetic. A small circular tool called a punch is then used to remove a core of tissue, usually about 4 millimeters in diameter. The sample includes skin, hair follicles, and underlying tissue like the sweat and sebaceous glands. After the tissue is removed, the site may be closed up with a few stitches or left to heal on its own, but usually they close it up. And depending on the size of the biopsy and even the number of biopsies, because sometimes doctors, if they're really suspicious that one side has a different condition and another side has a different condition, they'll do various biopsies, right? So this also factors the location of the scalp. This would dictate whether or not stitches should be used, or maybe a sort of hydrogel-based bandage, which could be used to limit infections. It should be noted that the area where the biopsy is done creates fibrosis or scarring. But honestly, scarring for losing 50 hairs that probably were dealing with a severe condition or some sort of weird condition to begin with, you losing those 40 or 50 hairs is worth it because it can tell you the potential fate of maybe 100,000, maybe 50,000, depending on how much hair you have on your scalp, right? So this is a good deal. Next, the extracted tissue is then sent to a pathology lab, where it is processed and examined under a microscope. Histopathologists look for specific signs of disease such as an inflammation, scarring, or abnormal hair follicle structures. The biopsy results help doctors make an accurate diagnosis and determine the most appropriate treatment plan for the patient. So, scalp biopsies are a very valuable diagnostic tool, providing detailed information that can confirm or rule out conditions that might not be identifiable through clinical examinations alone. And that's just where, the doctor kind of looks at your scalp and says, well, maybe nothing's going on, maybe something's going on. Here, scalp biopsies are a much more elucidative tool to help figure out what the hell's going on and why you may not be responding to a particular treatment. So that's kind of like the treatment intervention that I can see addressing if somebody is to have their DUPA or retrograde alopecia sort of, diagnosed with a biopsy. And if that biopsy comes back as lichen planopilaris or some other condition, now you can effectively know how you would go about potentially treating it. DUPA itself is not its own condition. Let's get that through our head. DUPA, diffuse unpatterned alopecia, and retrograde alopecia are not conditions of their own. They are just aesthetics. They are just appearances. In order for you to know what your DUPA is and what your retrograde alopecia is, you need to get a biopsy done to further kind of, make that obvious to you. Don't play any games. Don't waste time. Because some people might say, well, I've never seen anyone respond positively to dutasteride who had DUPA. Yeah, because maybe they had another hair loss condition. Did they get a biopsy? Right? Did they get a KOH test? Maybe they have some sort of fungus or microbe, doing the funny dance in their scalp and eating up their hair follicles. Right? These are things you have to do. And I'm kind of being strict here because I just see these comments all the time where people are like, oh, there's nothing you can do. And then they make up this crazy ass thing where it's like, well, the reason why it's not working for you is because dutasteride raises scalp DHT at 222%. And this means, or they might say something stupid like, oh, it raises scalp testosterone by 5,000%. And that's why you're losing your hair because it's still an androgen. No, that's not the case. Let's just simplify this and make this, much more easier to understand. Dutasteride is wiping away a lot of scalp DHT. So if you're getting worse on dutasteride, that means you have to start looking in other areas because one, time is of the essence. So you have to start getting that sort of scalp biopsy to see what's going on there. You have to get that KOH test to see what's going on. Because I would guarantee you, if you're still losing your hair on dutasteride, it isn't because of high scalp testosterone levels or or a backdoor pathway that upregulates DHT in the tissues, or the reflux hyperandrogenicity level, or you becoming more sensitive with your androgen receptors. No, no. The likelihood here is that you have another condition, right? And I'm going on a rant here. If you notice that you have skin, like pimples on your scalp, if you notice a burning feeling where you're losing hair, like an itchy burning feeling, if you notice these weird plaques or redness on your scalp or discolorations, if you're seeing like white hairs, right, that are coming out of your area of hair loss, if you're seeing these sort of things, this all should prompt you. Even if you feel one thing, a weird itchiness, this should prompt you to get that scalp biopsy. So you might ask me, well, lichen planopilaris, doesn't that have a specific feature? Doesn't it look distinct? No. In fact, it can adopt patterns that are very similar to the Norwood scale. So, we have literature on that too. And that's also worrying.